my name is John Christopher, founder and director of the Oda Foundation. We're an organization based in Western Nepal focused on health and health education for some of the country's most remote and underserved people. In the coming year, we hope to more than double our reach and impact, serving a Nepal that's currently reeling from recent earthquakes and political unrest. Before getting to that, I want to talk to you guys a little bit about my journey to Nepal, how last year TFN really transformed our organization, and how in the coming year we hope to make an even bigger contribution in Nepal. Prior to Nepal, my life was about as different as you can get. I was working in the financial services, making good money, living with some of my friends, and this picture's begrudgingly in here, doing more than my fair share of partying. Despite this life of relative comfort, I found myself searching for meaning that I really wasn't finding through a increasing salary, and meaning that I definitely wasn't finding in the bottom of a can of beer. In this search for meaning, I found myself at a children's home in Nepal and ended up visiting the Calicut district, which is in the remote Karnali zone. While I was there, I experienced a place that, according to UNICEF, is enduring a silent emergency. It's one of the most deprived places in the developing world. I met kids that weren't going to school and heard stories about kids that were dying, all because really basic needs weren't being met, and there was nobody there to fill that void. In response to that situation, rather than returning home and going to business school, which was my original plan, I knew that I really had the skills that I needed already to make a meaningful contribution to the lives of the people in this area. I had found a cause that spoke to me, an area that I cared for, and most importantly, a group of people that I really fell in love with. So in response, we founded the Oda Foundation, armed with $13,000 or $20,000 and paying for fundraising out of my own pocket. We had a team of 3 and successfully transitioned this small cowshed into a health facility. In our first year, seeing over 5,000 patients, all for less than £2 a patient visit. We quickly grew out of this facility. While we were working there, I was living in a small mud hut without electricity or running water, focusing on my language skills and understanding the culture. We quickly grew out of the cowshed, which is where CFN stepped in last year. With the support of the TFN community, we successfully transitioned from that small cowshed to this amazing health facility pictured here. It was built in the center of the community, and we've become an increasingly respected and trusted place for people to come for support. It was built entirely with donated land and largely donated labor, with locally harvested and sustainable materials, and is powered by renewable energy. We continue to target frontline medical issues, and year to date, this graphic shows 9 months to date, but year to date, we're on track to more than double the number of patients that we've seen, as people are coming 7, 8, 9 hours each way for care. All the while, our economics have actually improved, and the average patient visit is about £1.34. This recent success is why I'm here tonight. Because of the work that we've done in the Calicut district, the government of Calicut came to us with an offer for this building. In contrast to our current site, which is about 3 hours from the road, this building's just seconds from the road. It'll provide an extremely valuable platform, not only as we expand our curative care, but more importantly, as we look to become a resource for prevention and a nutrition outreach program in the district. The government, in addition to this building, extended an invitation for us to work with their existing government network, which is expansive but broken. Initially, we hope to target 3 of Nepal's most at-risk population: young mothers, their infants, and adolescent girls. Currently, we're designing a program that will work with 2,500 young mothers focused on early childhood nutrition. In a place where 55% of kids under the age of 5 are malnourished, this is hugely important, not only for the present, but as we work to create a healthier generation of people. Additionally, we'll be working with 6,000 adolescent girls in continuation of a pilot program pictured on the left that we did in Oda, and we'll be passing out these reusable maxi kits with the hope of increasing school attendance, increasing self-confidence, and sanitation. One of the great things about this program is it's not only going to be about educating the population, we'll be educating our organization as well. making us more effective when we transition to this new building to accommodate some of the diverse illnesses that we see. People like this won't have to walk 7 to 8 hours anymore, as will be located near the road. In addition, we have a $108,000 grant of medical supplies and equipment that will increase the level of care, decreasing the reliance on referencing out to a secondary hospital, a hospital that's about 15 hours away. Going forward, we look to work with our expansive network of partners to build out these programs into the remainder of Calicote and the Carnley zone. Looking forward, and why we need your help tonight, this isn't just a shot in the arm for the Oda Foundation and the community that we work. We have the opportunity to use this facility as a platform for future growth, for future partnerships with the government, as we aggressively expand preventative programs and as we expand our curative platform as well. Funding will go towards new medical staff, refurbishing the building, a comprehensive lab, solar equipment, and to fund the kickoff of these initial outreach programs. We have an amazing opportunity to help in Nepal right now that is having one of the worst years in its history. I've talked to people in the country since 2006, which is when their civil war ended. They say this year is worse than some of the worst years in the Civil War, between the earthquake and what's going on. So we're in an amazing, amazing position to do an incredible amount for a lot of people that really need the support and appreciate it. Thank you.
Thank you. Thanks so much.